Good morning, Dr. Eric here at Fanwood Back Relief Center. Today we're going to talk about corrective behaviors that cause upper cross syndrome. Upper cross syndrome patients often demonstrate posture defects such as forward head posture, where the head is coming forward in relation to the shoulders, rounding shoulders, okay? Forward shoulders, and also an accentuation of the curvature in the upper back, where we start to see this hunchback like this. These postures are becoming more and more prevalent, especially with kids spending a lot of times on their phones, on tablets, on video games, and even with adults as well. At work, they're spending time on the computers, and if they're not properly ergonomically set up, postures become faulty, we become lazy. I'm suspected as well. And then they go home and go on to tablets or go on to phones or go on the computers and spend more time in that posture that's causing the rounding or forward head posture. So what this causes is a lot of tightness in the neck, the upper back, the shoulders, across their chest. And we have to start to address these issues because more and more I see patients come in with these types of postures and the same pain patterns of the neck, of the back, upper back, not being able to turn the head the whole way or tilt the head or flex forward or back. And these become an issue, not only for pain. Pain is the first thing that usually occurs, but postures left in this position creates a lot of stress on the areas of the spine that it's not supposed to. Abnormal loading causes changes, physiological changes in the spine. We start to see early onset arthritis, degeneration of the bone, discompression. And when it starts to get into the nerve, we see symptoms into the arm and the hand. So there's corrective measures you can do. Now, first and foremost, from a chiropractic standpoint, we want to make sure that those joints are all moving properly. They're gliding, there's no restrictions. From the neck all the way down to the tailbone, we want to make sure everything is gliding and moving as it should, because when those joints get locked down, it creates inflammation, it creates swelling, and instead of moving with you, it moves against you and causes a lot of problems. So we want to make sure that the proper motion in the joint. That's number one. Number two is when you're not in the office and you're spending a lot of time sitting or on these different devices, it's important you take time to stretch the muscles that are being utilized, that are being tightened up, that are stiffening. And then also strengthen the muscles that are getting weakened as a result of all this time in these poor postures. And what we do is with all of our patients, we give some general recommendations for stretch and exercise and then specific ones based on the patient's needs. A recent study I was reading about how nearly half kids up to the age of 10 have what's called forward head posture or rounding shoulders. So it's becoming more and more prevalent. The last thing we want to address is the actual ergonomics. So setting yourself up, whether you're on your computer or on your phone, playing video games, whatever it is, setting yourself up to have the best posture you can. Now, eventually it gets tiresome and it fails, but if you're aware of it, that's the first step. If you're aware of your posture and you're aware of the proper corrective measures to do when you do spend a lot of time on these devices and you do spend the time stretching and exercising the areas that are utilized or overutilized, I should say, where there's a lot of stress, then we can combat this in a positive manner. Any questions about this, just give us a call, shoot us a message. You can check out more information about our office at fanwoodbackrelief.com. Hopefully you enjoyed this video. It's informative. Any questions, just follow up with me, and I'm glad to answer all of your questions. Have a great day.